I get these questions multiple times a day, and I want to just clear it up here. I'm hoping this is nice and clear. My name is Dr. Noor Al-Hamidi. I'm a family physician and menopause specialist. So, progesterone in the form of micronized progesterone, which is the same as you make in your body, has two utilities in HRT. The first one is that it antagonizes the estrogen at the level of the uterine lining. What do I mean by that? I mean, if I give a woman who has a uterus estrogen, her uterine lining will thicken as if we're preparing her for pregnancy. And we don't want that. That can cause bleeding and polyps and hyperplasia, and in rare circumstances, it can cause endometrial cancer. So we can't have that. Progesterone antagonizes, so goes against estrogen at the level of the uterine lining. So progesterone keeps the uterine lining thin. So if I have a woman who has a uterus and I give her estrogen, I must also give her progesterone. So that's one utility of progesterone. The second one is for symptom management. Progesterone is what we call our stress management hormone. It's the hormone, it's our Bob Marley hormone. It helps to keep us calm. It's very useful for patients that are having difficulty sleeping, with anxiety, irritability, anger. So if I have a patient that's struggling with those things, I'm going to use progesterone to help manage that. So if a patient has a uterus and I give her estrogen, I must give her progesterone. That's not to say that if she doesn't have a uterus, for example, if she's had a hysterectomy or if she's had a uterine ablation, or even if she has an IUD like a Mirena IUD or a Kyleena or a Skyla that's releasing a little bit of progestin into that uterine lining, that doesn't mean that if I don't need it for the reason of the uterus, doesn't mean that I can't use it for the reason of this effects that it has and the symptom management. So you can use the progesterone for two different things. The other thing, and this always comes up, is if I'm using vaginal estradiol or vaginal hormones, do I need progesterone? So if you are using only vaginal estradiol in the form of a vaginal estradiol cream or Intra-Rosa or Vagifem or Uvafem or the E-string, which is low dose vaginal estrogen or hormones, for the vaginal lining, there's not enough hormone in there to affect the uterine lining. So you don't need to give the patient the progesterone for the effect it has on the uterine lining. However, if that patient is struggling to sleep and having irritability and anger and anxiety, go for it because it's going to help those symptoms. I hope that's nice and clear.